My question is, should performance enhancing drugs be allowed in sports? In my opinion, no, I don't think PEDs should be allowed, but a lot of people disagree with my statement. And some people think if you let certain people use PEDs, that it will level out the playing field and people who aren't as big and strong become bigger. Performance enhancing drugs are substances that are used to improve any form of activity performance in humans. The use of performance enhancing drugs in the modern Olympics is on record as early as the games of the third Olympiad, when Thomas Hicks won the marathon after receiving an injection of styrosine in the middle of a race. The first official ban on stimulated substances by a supporting organization was introduced by the International Amateur Athletic Foundation in 1928. Using drugs to cheat in sports is not new, but is becoming more effective. The primary reason why performance enhancing drugs are allowed in professional sports is that they give users an unfair advantage over the rest of the field. Various professional sports leagues have attempted to set a level playing field by testing for drug use and suspending those found guilty. Many of the drugs taken illegally are designed to increase their athletic performance. In some people's opinions, if they made drugs legal and freely available, there would be no more cheating. But what I found is that there isn't a lot of positives to allowing PEDs usage in athletic sports. And all I've found is people say that certain drugs, such as EPOs and growth hormones, are natural chemicals in the body. As technological advances, drugs have become harder to detect because they mimic natural processes. In a few years, there will be many undetectable drugs, and Hewens' analysis predicts that the obvious that when the risk of being caught is zero, athletes will choose to cheat. One of the main questions people ask about performance enhancing drugs is, what does doping do for athletes? Doping is the practice of boosting the number of red blood cells in the bloodstream in order to enhance athletic performance, because such blood cells carry oxygen from the lungs to the muscle. A higher concentration in the blood can improve an athlete's aerobic capacity and endurance. Most serious athletes will tell you that the drive to win is fierce. Besides the satisfaction of personal accomplishments, athletes often pursue dreams of winning a medal for their country or securing a spot on a professional team. In such an environment, the use of performance-enhancing drugs has become increasingly common. But using performance-enhancing drugs has risks. The health risk and many unknown regarding so-called performance-enhancing drugs are anabolic steroids, human growth hormones, EPOs, diuretics, creatine, and stimulants. You may decide that the benefits aren't worth the risk. Some athletes take a form of steroids known as anabolic or androgenic steroids, or just anabolic steroids, to increase their muscle mass and strength. The main anabolic steroid hormone produced by your body is testosterone. Many athletes take anabolic steroids at doses that are much higher than those prescribed for medical reasons. Anabolic steroids have serious physical side effects. Men may develop prominent breasts, shrunken testicles, infertility, prostate gland enlargement, and women might develop a deeper voice, a enlarged clitoris, and increased body hair, baldness, and infrequent or absent periods. Both men and women might experience severe acne, increased risk of tendinitis and tendon rupture, liver and tumors, increased low density in cholesterol and high density in cholesterol, high blood pressure, heart and blood circulation problems, aggressive behaviors, rage or violence, depression, drug dependence, and infections or diseases if you're infected with the drug, such as HIV or hepatitis. And also, it can stunt your growth and development, which can cause future health risks for younger teenagers or adults. Another drug that is very common is human growth hormones. Human growth hormones is a hormone that is an antibiotic effect. Athletes take it to improve muscle mass and performance. However, it hasn't been shown conclusively to improve either strength or endurance. Human growth hormone is available only by prescription and admission by injection. Adverse effects related to human growth hormones range in severity and may include joint pain, muscle weakness, fluid retention, diabetes, vision loss, carpal tunnel syndrome, enlarged heart, and high blood pressure. These are just some of the most common drugs and there are several more out there that have way more severe side effects. Performance-enhancing drugs aren't fair to the game and cheating on another level. So in my opinion, PEDs should not be allowed in professional sports.